Howdy everyone, Madam Mateo here, coming at you with another special test, and maybe it's not much orthopedics, but one that we would probably use in orthopedics, and that is Homan's sign or a Homan's test. You know, that one that we learned to test for a deep vein thrombosis. So it has a bit of an interesting history. So the first mention of it was back in 1931 by someone named Treshmark or something. I got it right here. And they described that there was an increased resistance to dorsiflexion in someone with a venous thrombosis. But you're probably going, Matt, it's called Homan's sign. You know, what about Homan? Well, that's where it comes in. It was named after Dr. John Homan, and he was someone who did a lot of work on the development of vascular surgery and the treatment of vascular disease. Now, he apparently had spoke about this quite often in his work in the early 1900s, but he finally mentioned it in a paper in 1941 where he was talking about early intervention of surgery, and that surgery was to interrupt the femoral or iliac veins in people with a DVT, because the use of anticoagulants were not a standard treatment at the time. So he was saying, oh, if someone has a calf vein thrombosis, the surgery was life-saving. So it's like, we need to do that surgery. So we need to recognize it. Now, interesting thing, he actually called it dorsiflexion sign originally, and it only started getting called Homan's sign or Homan's test years later after just kind of this mention. But anyway, let's get in on how to do it. To perform this test, you have the person lying on their back. Then what you do is that you keep the knee extended, you raise their leg up. Then you apply a forceful dorsiflexion through here. And if that produces pain, you want to go to the second part, which you flex the knee and you squeeze the calf muscle right here. So you perform a squeeze of it, and if it produces pain, that is a positive. So getting in on the research for it, one, there's not a lot, and two, it's not really supported very well. It doesn't look like it's very good. But I will say, in that original article back in 1941, Dr. Homan only spoke in one sentence about this test. He just said, by a combination of clinical symptoms with discomfort behind the knee on forced dorsiflexion of the foot. So he just kind of made this comment, but he was kind of relying a lot more on the physical examination as well. And this just happened to be one of the things there. And he said to diagnose a DVT, you would also want to look at localized calf tenderness, edema, the clinical course, and a suspicion of a venous thrombosis. Now, there are some papers, and I will say, if you look at a lot of it, some people just kind of put all these combinations of things to talk about the, this like how, whatever with this test, and they reference two of them. Interesting thing, they're actually pretty old. So one of them was in 1969, and they looked at 72 people, and these people were suspected of having a DVT, in which only 33 of them actually had it based on a venography. So just being able to detect it with that. And it was, the Homan's test was only positive in about a third of them. So about 11 people that actually had a DVT did show a positive. So that's not pretty good. And they actually found that it was actually positive in 21% of the people who did not have one. So it was there. Now in 1980, another one, they looked at 102 people who were suspected to have a DVT, and they were assessed, they had the venography performed, but they found that it was more positive in people who had no DVT. They found it was more positive in those people. So they said it's not a great test. That's what kind of they're saying. Now I will say, if there's any kind of new research or anything on it, please share it. That'd be very interesting to read that. And they say the gold standard, of course, is look at the physical signs, and if it raises suspicion, that imaging is more of the gold standard. And I would know for myself, I've had roughly 9 or 10 people who I have suspected of having a DVT based on their presentation when they came in, and I will tell you, of those people, only one actually did have a blood clot, and everyone else got sent off for imaging, got sent for Dopplers immediately. And like I said, only the one came back that was positive. But I will tell you, in every single one of them, this test was positive, or it was very confusing on it. So you couldn't tell, like, is this really a true positive, or are they saying it just hurts? And so it was just a little murky, actually, when I have used this test with people who I have suspected it. But like I said, it's just one of those ones when they present it, it looks a little suspicious. This possibly is positive. We're just going to send you off and make this test just to make sure. But anyway, that is Homan's test. Let us know. Do you use it? Do you like it? Is it part of your clinical examination? What do you think about it? Again, you'd be found positive. Anyway, if you enjoy the video, please hit that like button. It helps out Mateo so much. He loves it so much. And as Mateo also always says, take care of yourself. Take care of your patients. We'll see you next time.